Thank you very much for asking us to present this today. Obviously, there's a lot of changing information with COVID on a daily basis. Clearly, when the Transport Secretary manages to fly to Spain the same day that country's added to the list of places not to visit, I think that's a fairly good indication of how rapidly information is changing and being updated. So I'll put that now. The information we're giving today is valid today, but may change in the coming days. So at the end of the presentation, I will be having a slide with some of the websites for each of the 4 countries of the UK, with that guidance, which is probably the best place to visit for information that's up to date and accurate. So obviously, so that's led to some of the guidance that we've been following being relaxed. I was vulnerable to COVID-19, which is ataxia. The advice still is to stay at home as much as possible, in spite of the alert being changed from 4 to 3. That we're not seeing.
Suzanne, I think Suzanne, if possible, you should stop the video, because your voice gets stuck, and also your face. So possibly the internet is not good, and if it would be good if perhaps you stop as well the video.
I'll try that.
Yeah.
Can you still see the slides?
We can see the slides, yeah, and we can hear you better now. If you could sorry, could you just start this slide again?
Sure.
The sound wasn't great, thanks.
So obviously at the moment, the alert level has changed from 4 to 3 across all 4 countries of the UK. That doesn't mean the virus has gone away. It just means that it's now in general circulation, but we're not seeing rising cases of transmission within the community. So the advice is still to stay at home as much as possible for people who are vulnerable to COVID-19, which is anyone who has ataxia. But it is reassuring that the risk is definitely lower within the community at this point. So a little bit of advice on keeping safe outside your home. So we know that coronavirus is spread by droplets in breath and from the nose and the mouth. There is some emerging evidence in recent days that there is thought to be the possibility of airborne transmission as well. So that just means that very small droplets of the virus may be staying in the air for longer than we initially thought. But that obviously is still being debated. Primarily, we think that the virus is transmitted by droplet transmission, so coughing, sneezing, and then you contaminating yourself by touching your nose or your mouth or breathing in those virus particles. We know that it's close contact with other people that is the main risk, and in particular face-to-face contact, and more specifically a sustained contact. So eating, passing by somebody in the street is less likely to be a problem than standing in front of somebody and talking right in front of their face for more than 15 minutes. We know that the virus can live on some surfaces for hours to days. Again, there's a lot of debate in terms of different surfaces and how long the virus survives on them. So there'll be comments on it lasting longer on metal versus plastic and soft surfaces versus hard surfaces. I think the take-home message is that it does stay on surfaces for at least hours, and it's probably safest just to assume that any surface you touch outside your home is potentially contaminated, and to take adequate precautions if you do touch other surfaces outside the home. I think generally before you go out anywhere, it's a good idea to have a think about where you're going and to plan how you'll keep safe and minimize your risk. which I'll go into in a little bit more detail in the coming slides. So in terms of the advice on keeping safe, nothing has changed to the original advice, which is frequent hand washing is still the primary way that we can eliminate transmitting this virus. In recent days, we've been advised to wear masks in certain situations, which I'll cover in a bit more detail. And social distancing is still extremely important. In terms of where the risk is higher and lower, we do know that in outdoor spaces, the risk of transmission is clearly less than indoors in a confined space where you may have poorer ventilation. So I think when you're going out, thinking about where you're going, where those risks are higher and lower, is probably a good idea. As a general rule, we would suggest that you avoid going to places at busy times and ensuring as much as possible to keep 2 meters from the people that you don't live with. In Northern Ireland, England and in Scotland from the 10th of July, where it's not possible to maintain a 2 meter distance, 1 meter plus is allowed. And that just means that if you can't keep 2 meters, you should have other protections in place. So for example, a mask, making sure there's a plastic screen in front of you, for example, at the cashier and the supermarket, and ensuring that you've got as good a ventilation as possible. Continue to follow good hygiene practices, including regular hand washing, not sharing crockery, cutlery, and making sure surfaces are cleaned as often as possible. And while the guidance has changed that you are now able to go into other people's homes and into shops and restaurants, clearly it's still safest not to go into other people's homes that aren't a part of your family or your extended household or bubble, which I'll again talk about in a bit more detail. So you can now leave the home for any reason, including going to the shops, restaurants, exercising, or spending time socialising outdoors. It starts to get slightly more complicated now because all 4 countries have got slightly different variations on these rules. So outdoors, in England, you need to stay 2 meters apart and in groups of no more than 6 people. In Northern Ireland, it's 30 people. In Scotland, it's 8, but from only 2 households per day. And in Wales, it's from no more than 2 households at any one time. So clearly you need to focus on where you live and pay attention to that specific advice. In terms of going inside someone's house, in England and in Scotland, they're fairly similar rules. So 2 households of any size in England can enter each other's houses, and up to 8 people from up to 3 households in Scotland can meet inside or outside and can stay overnight in the same household. You need to follow social distancing still when you're staying in somebody's house or staying overnight, unless you formed an extended household or a bubble, which, moving on to the next slide, just means you're essentially considering another household to be a part of your family. So in the same way that you don't need to social distance from the people that you live with currently, you can now create a household bubble with another household, and you can meet each other in each other's homes and not be more than 2 meters apart, and you can stay overnight. These support bubbles or extended households must be exclusive though, so you can only join one household and that household mustn't join a bubble with another one. So it's really just giving you a slightly larger circle of people you can be a little bit closer with. In England and Northern Ireland, if you live by yourself or you're single with dependent children, you can form a support bubble with another household of any size. In Scotland, you can only join another household if you're on your own, and you can only join another household where that household is a single person or single with dependent children, so slightly more restricted. In Wales, any household can join with any other household of any size to create an extended household. So it's all slightly different, but essentially they're all just guidance for how you can create a little bit more support with each other with the restrictions of being a limited number of people. Now on to face masks and coverings, which is obviously an area that's caused a lot of debate and angst and confusion. So essentially the purpose of face masks or coverings The idea is that I wear a mask to protect you and you wear a mask to protect me. So by wearing a mask, we're stopping that droplet transmission. So if I sneeze or cough when I'm wearing a mask, I will protect you by containing those virus particles in my mask and vice versa. So the important thing with a face covering is that it should cover your nose and your mouth while still allowing you to breathe comfortably. So it should fit snugly, but not be so tight that you feel like your breathing is restricted. It needs to be securely fastened around the side of your face, so with head ties or ear loops. It can be made of any material that is comfortable and breathable, such as cotton. The guidance is that it should be at least 2 layers of fabric. World Health Organization recommends 3, depending on the type of fabric used. So clearly, if you're using a thicker type of cotton, 2 is probably fine, but they're accounting for people having sort of varying degrees of thickness of that fabric. Unless it's disposable, it should be able to be washed and can just be put in your laundry with everything else with your normal washing detergent. It doesn't need to be on a particular hot wash or any particular type of detergent. I would say it's a good idea to have more than one face covering out with you when you do go out, so that you can replace it when it begins to get damp. So I think always, take at least a couple of masks out with you. And there's lots of information on the internet on how to make a face covering from things around your home. It doesn't need to be a medical mask. There are lots of websites selling all sorts of fancy, attractive and varying degrees of comfort, I'm sure, masks. There's also a website I've put on this slide, the Big Community Sew, which has lots of instructions on how to make your own, from things from socks to bras even. So obviously in the last couple of days, the advice has changed on where it's compulsory to wear a mask. So in Northern Ireland, England and Scotland, it's now compulsory to wear a mask on public transport and in shops. In Wales, it's just on public transport. I think probably as a general rule, given we know that the risks of transmission are higher indoors and outdoors, I would probably recommend wearing a mask in any sort of indoor space, whether it's compulsory or not. You may also be asked to wear one in certain situations like GP or hospital appointments, but you should be informed of this before you go. Just a little bit of information on hygiene when you're putting your mask on and off. Obviously, touching your face is slightly unavoidable when you're putting a mask on, so you obviously need to make sure that your hands are clean before you do that. So you need to wash your hands thoroughly with soap and water for 20 seconds or use a hand sanitizer before you put the mask on. And anytime you remove your mask, you need to make sure you wash your hands so that you don't contaminate yourself in trying to remove it. And then again, after you remove the mask, you need to wash your hands again. So a lot of hand washing. I've got a small YouTube clip there, which I think you can probably watch yourself later. I think we need to put it on now, but just to be clear that, taking a mask on and off is a risk point of contamination. So to be really careful with washing your hands. I would suggest just always taking a hand gel out with you so that you can wash your hands wherever you are. And if you're taking your mask on and off between going to shops or into a restaurant, you want to be able to do so safely. A lot of people have obviously commented in Ataxia that there are some issues with wearing a mask and that affecting your balance, and I totally appreciate that is a challenge. So there is clear guidance that you do not need to wear a face covering if you have a health problem or a disability, which means that you can't put it on, wear it or remove it safely. In terms of advice on how to improve the situation if you are having problems with your balance and wearing a mask, I would suggest getting a mask that has a metal strip in the top of the mask, like the one at the bottom here, the medical one. A lot of the homemade ones you see you can buy on the internet, they do often have this metal strip in them, and that just means you can mold the mask as closely to your face as possible. I think that's really key to sort of give you the best field of view when you're looking down wearing a mask, is to make sure that mask is fitting as closely as possible. That will also help with things like your glasses steaming up. If the mask isn't fitting well at the top, your breath is going to be coming up, and that will obviously make your glasses foggy. There's a little link there as well from Specsavers, which has some very good advice on how to prevent that as well, making sure your glasses are clean, because that can make things worse with them fogging up, and making sure they're tight fitting is the main recommendation. If you really struggle to wear a mask, it's clearly fine to not wear one. You don't need to provide any sort of evidence for not needing to wear one, but clearly some people might feel more comfortable having something on than saying some medical reason for not wearing one. I think we're probably seeing increasingly out and about people getting upset when they see people not wearing masks in certain situations. So I've just put a link there for the Hidden Disabilities website, where you can order a face covering exempt card. The government website also has a little template for something that you can create yourself. So both of those things are something to consider, but you might just feel a bit more confident going out and not wearing a mask if you have something on you to explain why you're not. Some people have inquired about face shields or visors, like the one on the page here. So they're obviously the sorts of things we normally see in a medical environment, and they would normally be worn with the mask underneath. So their normal role is to prevent splash infection. So you've still got the mask covering your mouth and nose, and the shield goes over the top to protect you from splash. I think there's no clear guidance on the England, Wales and Northern Ireland government websites about whether this is an alternative. I would suggest that if you struggle to wear a mask, this might be a good option. The Scottish website does say it is possible and permissible to wear a face shield or visor in lieu of a mask, but it clearly does need to cover your mouth and nose still. I think if you can't tolerate a mask, this is clearly better than nothing, so definitely worth having a look at. And just finally, on the topic of masks, I think it's important to remember that this doesn't replace all of the other previous advice. So physical distancing and hand hygiene and respiratory hygiene are still the most important things we can all do to prevent the spread of coronavirus and to protect ourselves from being infected. So that's washing your hands regularly. If you've got a cough or a cold, use a tissue, put it in the bin straight away and wash your hands. So those sorts of things are still the most important thing. And wearing a mask doesn't remove those. So in terms of the shielding measures for people who are extremely vulnerable to COVID-19, we've covered in previous webinars the different categories. So as I said earlier, anyone with ataxia, because they have an underlying medical problem, would be classified as vulnerable. That just means you're slightly at more risk of worse infection or more difficulties, if you like, just because you have an underlying problem that will be exacerbated. So we know with ataxia, if you have any sort of infection, you might notice that your balance and coordination is a little bit worse while you're unwell with that infection. People who are in the extremely vulnerable category, ataxia with cardiac complications, respiratory problems, diabetes or high blood pressure. So you've essentially got two things going, or more than two, which just mean you're at higher risk of severe illness. So neither of those categories mean you're more at risk of getting it. It just means if you do, you're probably more likely to be more unwell than the rest of the population. So people in this extremely vulnerable category, you should all hopefully know who you are by now, because you should have been contacted by NHS Digital or your consultant. You should have been advised to shield over the last 4 months, and it's only people who've been contacted that need to take those precautions. So obviously, as the rates of transmission in the community have reduced, the guidance for people who are shielding is being relaxed. I would say you still need to remain cautious. The virus is still out there and you're still at risk if you are unfortunate enough to come into contact with it. So the advice is still, in spite of being able to do more and to go out more to restaurants and shops and all the rest of it, is still to stay at home as much as possible. And when you do go out, to just be extremely careful and follow the social distancing and hygiene advice. I think it's important to remember it is government advice, it's not the law. So you're welcome to take the level of risk that you're comfortable with. and I think to be aware that the guidance is likely to change as the pandemic evolves. So as we've already seen in places like Leicester, where the transmission rates have suddenly started to go up, the restrictions that were lifted in other parts of the country have returned. So whatever advice we're talking about today, I think it's important to follow your local advice. And I think going forwards, we're probably going to see more of that very specific advice for regions in the UK as things change. So again, the guidance is slightly different in each of the 4 countries, as you would expect, with slightly different levels of community transmission. So I'll just talk briefly about all 4 different areas. So in England, from the 6th of July, you no longer needed to socially distance from the people that you live with. So that means from that date, you're able to share a bathroom, eat meals together, and not socially distance within your home. You can meet with a group of up to 6 people outdoors, including people from other households, obviously still maintaining a safe distance and wearing a mask if you can't keep those 2 meters safely. People who live alone or who live only with children under the age of 18 can agree with another household to form an extended household or a bubble. So essentially that means you treat them like you would the other people in your home, that you don't need to keep those 2 meters distance.
Oh, Suzanne, we can't hear you anymore. Let's just see if she comes back. Don't know if you can hear us, Suzanne.
Can you hear me now?
Oh, yep, you've come back now.
Sorry.
Sorry. Thanks. Could you just start this bit again? Thank you.
Where did you lose me?
Just start with this slide again. Thanks.
So maybe, Emily, if you could just put up your hand if you lose me, and then I'll stop. Okay.
Okay, I will do.
So from the 1st of August, the shielding advice in England will be paused. So that means all of the previous advice will stop. You can behave as everyone else in the community, though clearly you are still at high risk. So we would just say to still remain cautious and avoid, close contact with people as much as possible. The support from the National Shielding Service for free food parcels, etc., will stop. The NHS volunteer responders will still be able to carry on supporting you with delivering food that you buy and prescriptions, etc. You'll still be eligible for priority supermarket slots. You can go into work as long as the workplace is COVID secure, but you should clearly still carry on working from home if you can. Children who are clinically extremely vulnerable can go back to school when the rest of their class goes back.
Hang on, Suzanne. Suzanne?
Yes.
Sorry, we just lost you there where you said that you started talking about children going back to school. Could you just cover that again?
So the 1st of August, with that end to the shielding advice, children who are extremely vulnerable can go back to their schools when the rest of their class. Restaurants, places of work, etc. You're keeping 2 meters away where possible and wearing a mask if you can't. Changes to the shielding guidance in Scotland came into effect from the 10th of July. So at this point, again, you can stop physically distancing from the people that you live with. You can go indoors to use a toilet in someone else's house when visiting them. You can meet up to 8 people outdoors from 2 other houses a day. There are no further restrictions on the distance that you can travel from your home. You can stay overnight in self-catered accommodation or somebody else's home. People who live alone, again, can form an extended household or bubble with another household. And it's hoped that their shielding advice will pause from the 1st of August. And again, that will then mean you can have unlimited activity as the rest of the population. Changes to the shielding guidance in Wales. Outdoor exercise is unlimited as long as you follow social distancing and hygiene advice. Those who are shielding can meet outside with people from another household, but still should not go into another person's house or share food with them. The shielding guidance in Wales is in place until the 16th of August. They haven't released information as to what guidance will follow from that. So I think probably keep an eye on the Welsh Government websites, which I'll provide at the end. And again, the food boxes, etc., will cease from the 16th of August. In Northern Ireland, you're able to meet up with 6 people outside as long as social distancing and hygiene measures are observed. If you're shield alone, you again can form a support bubble with one other household. And that again just means that you consider them to be a part of your family, essentially, that you don't need to social distance. The household can be of any size, but that bubble should be exclusive. And let's hope that the shielding advice for Northern Ireland will also pause from the 31st of July. So in terms of if you are living with someone who's extremely vulnerable, essentially the advice is still to maintain caution in spite of the shielding advice lifting on the 1st of August. I think still work from home if you can, limit your contact with other people, keep your distance when you go out, keeping 2 meters apart where possible, or wearing a mask if that's not possible, washing your hands and clothes regularly, and I think probably utilising information on places like Carers UK about having a contingency plan for what support you can put in place if you become unwell. So clearly, if you become unwell with COVID-19, you will need to isolate from the person you're caring for who's extremely vulnerable. So having a plan in place for how you will be supported is really important. Contact test and tracing. Obviously, this has been rolled out all across the UK in various degrees of success. So what this means is that if you have symptoms, you can be tested. If your test comes back positive, you will be contacted by somebody from the department to provide information on anyone you've been in close contact with in the 2 days before you became unwell and the 7 days after developing symptoms. So close contact means anyone you've spent 15 minutes or more with at a distance of less than 2 meters, and people you've had direct contact with, so the people that you live with in your home. Those people will be notified by phone, email or text that they should isolate for 14 days. They won't be told who they were in contact with who had the virus though. So it's important if you've been contacted by anyone in the department that you do need to self-isolate for 14 days, even if you don't have any symptoms. Unfortunately, we're aware that there are a number of not very nice people taking advantage of this situation, and there are unfortunately a number of scams where people are contacting vulnerable people in the community pretending to be contact tracers. So I think it's important to know that people who genuinely call you in this scenario will never ask you for bank details or payments. They won't ask you for any details of other accounts or social media, passwords, PIN numbers, anything like that, or ask you to call a premium rate number like those on the screen. That's proving to be just as stressful going into lockdown. I know a lot of you are reporting quite anxiety about going out after being inside for so long, particularly if you've been shielding. So I think it will
Suzanne, you're breaking up a little bit.
Okay. So
we can hear you just breaking up a little bit. So if you just want to start this slide again about reducing anxiety.
Okay. Obviously, a lot of you have been in contact talking about finding it difficult to actually return to the new normal of going outside and going about your normal life. So I think it's important to remember that it will take time to find your way back to things as they were or as the new normal. So to be kind to yourself, don't expect that.
We've lost you again. Can't hear you at all now, Suzanne. If you can see me or hear me.
I can, you've frozen, but
okay. It's all falling apart. Okay, so we can hear you better now. So maybe we could just try starting this slide again,
sure.
and hopefully this time. Yeah.
I'm feeling very anxious about this slide. So clearly, a lot of you are finding coming out of lockdown it's quite an anxious situation. You're used to being at home in your little safe cocoon and not going out. And I think for a lot of you, starting to go back to normal life is proving to be quite difficult. That's completely normal. I think everyone who has been stuck at home for the last 4 months is finding it very, very anxious to go back out to a restaurant or a supermarket for the first time. So I think just be kind to yourself and be aware that it will take time to reconnect with everything again. I think focusing on the things that you can
hang on, Suzanne. Sorry, you just started breaking up there. We were talking about focusing on what you can control.
Which clearly isn't my internet today. So obviously the things that you can control is when you are leaving the home to think carefully about where you're going and where the risks might be and how you might minimize those risks. So thinking about whether you'll be touching surfaces and how you might be able to avoid that, how you'll be able to practice good hygiene. So for example, taking hand sanitizer out with you so that you can wash your hands if you suddenly find yourself in a situation where you're touching lots of surfaces and then you're going to eat something. I think where physical distancing might be more difficult, think about what you might be able to do to minimize that risk. So I think in terms of controlling a situation, always taking hand sanitizer, a couple of masks with you and a bag for use tissues, those sorts of things, whenever you leave the house will hopefully reduce some of that anxiety. I think it's really important to continue looking after your physical and mental well-being. So just as when we went into lockdown, we really stressed the importance of finding routines, staying connected, eating well, and having regular exercise. Those things still apply and are possibly even more important now because we're under a more stressful situation now because the normal demands of life have returned in a way, but we're still dealing with quite a bit of anxiety in terms of the virus. I would definitely recommend limiting your exposure to a few trusted sources and probably just limiting the amount of times you look at that information in a day. I know personally, if I start looking at too much news and media, that really increases my anxiety levels. So I would definitely recommend just putting a cap on when you're going to look at the news in the morning and the evening, and don't look at it the rest of the day, because I think that can really increase people's anxiety. And I think also just focusing on the positives of coming out of lockdown and really focusing on the things that you can do now that you haven't been able to for such a long time, and focus on the present rather than thinking too much about the future. The future remains very unknown, and I think all of us, if we start to think about what might happen in 6 months' time, can become to feel quite anxious about that. I've shared this slide on previous webinars, but both Mind and NHS websites have got some very good tips on helping you cope with some of those emotions and anxieties that come with this situation. And I think if you do find that you're struggling to manage some of those feelings, it's okay to ask for help. And I think a good place to start would be speaking with your GP about some of the things that you're feeling. In terms of looking after your physical well-being, as I say, this is just as important now that we're coming out of lockdown as it was within the restraints of social distancing. So if you have a home exercise program, keep trying to do that daily at home. It is safe, even if you're shielding after the 1st of August, to start going to places like gyms. But I would be obviously aware of, you're going into an enclosed environment, the risks are clearly higher. So to try to go to those places when it's hopefully not as busy, and to be very careful with social distancing, take hand gel along with you so that you can be extra vigilant with washing your hands after touching equipment. And again, I've shared a couple of links with just some simple Pilates core stability-based exercises that you can do at home that we would recommend. And finally, obviously, there are a number of things that we can do to minimise our risk. So over the last 4 months, we've become aware of a number of things that lead to worse outcomes if people do become infected with COVID-19. So trying to do things like reducing excess weight. We know that people who are overweight or obese tend to have more severe illness with COVID-19. Trying to improve your cardiovascular fitness and making sure any underlying health problems that you have, like diabetes, high blood pressure, making sure those sorts of things are as well managed as they can be, will stand you in good stead. And finally, these are the websites for each of the 4 countries. As I said earlier, the information is constantly changing, so I would suggest just keeping an eye on those websites for updates as they happen. And that is the end. So I don't know if you want to lead on any questions we've already received, Emily.
Yeah, thank you, Suzanne. That was really, really helpful. We have got a few questions to go through. So I think it's really useful to get all the advice like that, because as it's changing, it's getting a bit confusing, isn't it? So thank you for going through all that so clearly and for covering the different countries, because we know it's different in the different countries now, which makes it more confusing. So we've got some questions that have come up in the chat box as we've been talking. So you did cover this, but maybe just to reiterate and say anything else that you might have to add. Is it safe for a child with FA to return to school in September?
Yeah, so I think no matter which country in the UK you live in, the shielding advice will be paused more than likely either the 1st of August or the 16th of August across the country. So at this stage, they are saying that it will be safe for children who are shielding to return to their school come September. But obviously, things are potentially evolving over the next couple of months. So I think just keep an eye on that shielding advice on the government website of whichever country you're living in.
Thank you. And somebody's asked, is it still necessary to sanitize packaging from groceries? I don't know if you have any thoughts on that.
So I think the evidence is that it's obviously a potential route for transmission. As we know, the virus can live on different surfaces for different amounts of time, depending on what type of surface it is. I mean, I think it's probably reasonable to just wash your hands if you bought something from the supermarket. When you open it, to wash your hands afterwards before you actually use that item. I think going forwards, this virus is going to be with us for quite a long time. If you have the energy to keep hand washing all of your supermarket items, obviously that's going to minimise your risk, but I think it would be reasonable to just take care with an item after you've received it to wash your hands, or if it's a parcel that you've received in the post, to just put it aside for 48 hours before you touch it if you want to reduce the risk further. But hand washing is still, the primary way that you can reduce your transmission. So the virus needs a route to get into your body, so it's not going to magically get into your body from your hands. You need to touch your eyes or your nose or your mouth. So I think as long as you're washing your hands after you've touched a potentially contaminated item, then you should be fine.
It seems like hand washing is still really important advice in all. Yeah, every time you're doing anything, really something to remember. Any other questions? So we had a question come in beforehand, which is about going outdoors in a wheelchair and about the risk of transferring the virus from the ground onto your hands. So I don't know if you have any ideas about that.
So we know that the virus doesn't live as long.
Suzanne, we've lost you there. Sorry, we didn't catch the start of that. Could you start that answer again, please?
So we know that outdoors the risk is definitely much lower than indoors, because in a confined space, there's less ventilation, so the virus will be more concentrated. So I would say outdoors, the risk is much lower. your risks outdoors are more that if you're in face-to-face contact with someone and you're in sustained face-to-face contact for sort of more than 15 minutes, I would say there would probably be fairly almost nil risk of virus from the ground coming up. I don't think there's any studies on that level of risk, but the virus doesn't live as long outdoors, and where there's good ventilation, the risks are reduced even further. So I would say outdoors, again, the same advice: avoid face-to-face contact and hand washing. That really is the best way to minimise the risk.
May I add something, another comment on these questions? Is Paola here?
Yeah, so, go ahead, Paola.
The question was as well related to somebody who is propelling, and so the hands necessarily are going to be more in contact with the wheel. The wheel are in contact with the obviously with the pavements. So in that situation, the suggestion would be to use gloves. And then again, as Suzanne has repeatedly in a very effective presentation, in addition to washing your hands, is also you will need to be very mindful, even if the hands are washed and so forth, not to touch your face. So this has been very much highlighted throughout the information that has been given to the government. So don't touch your eyes and don't touch your mouth. And it's incredibly incredibly interesting to watch everyone of us, for example, in Zoom, how many times involuntary and automatically we touch ourselves at the eyes and the mouth. So this is something that it needs to be taken into account and into our stride, and make a very important effort not to do so. Thank you.
Thanks, Paola. Yeah, I think it's true that we just involuntarily touch our face all the time, don't we? So being aware of that is really important. Thank you. Okay, we have a couple more questions in the chat box. So someone has mentioned that we know that a lot of people can have COVID-19 without having symptoms, and that testing these people seems to be important. I don't know if anyone knows any plans for that to take place, but I suppose the point to make there is that's why it's important for everyone to wear masks and to be wary of washing your hands and everything, to be aware that you might have the infection and not have symptoms, so to protect people around you by wearing a mask. I don't know if anyone has anything to add to that.
No, I mean, that's totally true. You, particularly given you're most infectious sort of the day before you develop symptoms, so you can be feeling completely fine, but you're actually highly infectious the day before you develop symptoms. So that's a very clear reason for wearing a mask, you know, in those places where you can't social distance or you're in confined indoor spaces.
Thank you.
I think there's also a number of studies ongoing on there, because they were asking whether we know what the proportion of asymptomatic people are, and I think there's quite a few studies ongoing to try and understand what that percentage is. And I think it probably varies depending on the countries. I don't have any stats to hand, but there are a number of studies ongoing, so we could try and find some information and put it on the website if we can come up with something, but I think it's quite varied, the proportion of asymptomatic people.
Yeah, I was looking at this yesterday, and the CNN put up some figures. There is around 35 to 40% of the infected people so far, they are asymptomatic. So obviously this is something that is an ongoing, as Julie Greenfield has said, is an ongoing process, and this percentage is going to be different when we are going to have more data. and maybe less or maybe more. So this tells a lot about, and this is, I think, what is we really need to stress out that this presentation, like the previous one, is going to change because we don't know still a lot about this virus, and the more information we get, the more precise we will be. And as a general advice, is to be very, very cautious, and also echoing as well what Emily has said, to wear the mask all the time, even if you don't have symptoms, you know, for yourself and for the others.
Thanks, Paola. So I think there's one question here in the chat box. Now, I don't think I can answer this question, but I might have something to add. So how many people with FA have had COVID-19 and what were the outcomes? So I'm not sure that we'll be able to answer that question, but just to let you know from Ataxia UK that we are working with our medical advisory panel who are looking into what impact having had coronavirus has had on people with ataxia, and we're looking at doing a survey that will hopefully be circulating in the next few months or so to try and learn a little bit about that. So I don't think that's a question we can answer yet, unless anyone wants to prove me wrong. No. Great, so I think that's everything. Yeah.
There's a couple of questions about vaccine
Oh,
trials.
there's some new ones, sorry, I missed those.
Just if there's any update on vaccine trials.
Yeah, so for the vaccine trials, this has been recruited, the recruitment for the vaccine trials is going extremely well, and one of the sites is UCL, and is exactly in the same place where we also conducted our drug trials, so we know directly about that. So I think seems to be quite positive, the Oxford vaccine, and but obviously we need to see the end, and so that all the data will be analyzed, and but it seems to be that it's going very well, and better than what has been anticipated.
Great, thank you. So I think that's covered all the questions that we've had. So I just wanted to add that Ataxia UK is putting on a lot of virtual activities in lockdown. So for information on any of them, you can see them on our website under the COVID-19 tab. There's all sorts of different things going on. So just to have a look at those. And I just really want to say a massive thank you to Suzanne and Paola, because that was so helpful. Yeah, and I know it's a lot of work, so thank you very much for offering to do this for us. I think everyone's found it really useful.
For asking us again.
Oh, thank you. And thanks everyone for coming. It's been brilliant to see so many people.
Thank you very much.
Thank you.
And
Thank you.
Thank you. Bye-bye.
bye.
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 Thank you.
Thank you.